Welcome to the deep dive. Today, we're kind of doing a cleanup operation. We're going to sift through this persistent myth about vitamin D, being some kind of magic shield against COVID-19.
Yeah, and it's really a perfect example of why critical thinking is so crucial. The immediate crisis might feel like it's winding down, but, well, cleaning up the scientific literature, that's far from over.
It really isn't. The scale is pretty staggering when you look at it. Retraction Watch has logged, 576 COVID-related papers pulled?
576 officially retracted, yeah, and dozens more are still under review. It's a slow process, fixing the record.
Definitely slow.
All right.
And if we zero in on that vitamin D myth,
Right. It was ground zero for a lot of misinformation, wasn't it? 9 of those 576 retractions were specifically about vitamin D supposedly fighting COVID.
9 papers just on that.
Just on that false claim. And these weren't like minor errors hidden away. They were public claims that really influence how people behaved.
And that influence often stemmed from just a few sort of high-profile papers. I remember one took 4 years to retract after concerns were raised.
Exactly. That one claimed vitamin D sufficiency. They defined it as 30 nanograms per milliliter reduced bad outcomes and even death.
4 years. That's a long time for flawed information to just sit there being cited.
A very long time. And it became like, well, gospel truth for many. And what really fueled that wasn't just the paper itself, it was the media splash that followed, often without much critical thought. Like that specific study. It was actually conducted in Iran. But Taiwanese media outlets were reporting it as U.S. research.
Why U.S. research?
Simply because the corresponding author was Michael Holick from Boston University. He's been called the father of the vitamin D elixir, unfortunately.
Wow. So the actual origin, Iran, got lost just because of the corresponding author's affiliation. Did that matter much once the narrative took hold?
Oh, it matters hugely. It shows how fast the story just detached from the actual facts. That initial mix-up, whether it was on purpose or just sloppy reporting, it helped fuel this big public push for supplements.
Right. You saw doctors, researchers even, telling people to take vitamin D.
Yeah, people like physician Jung-Kun Jun, researcher Ho-Mei Xiang, they were out there encouraging supplements, saying it reduces severe illness risk. It sounded like a simple fix.
And that contrast is the core issue, isn't it? The enthusiastic, maybe well-meaning promotion versus the slower, harder science.
It absolutely is. Promoting a supplement, it feels positive, warm, gives people a sense of control, but presenting the evidence against it can come across as, well, almost cold-blooded or ruthless.
I see that.
But you have to ask, right? When you look at the money spent, the health decisions made based on data that we now know was flawed and retracted, who was really being cold-blooded? Was it the science saying, hold on, or the advice built on sand?
That's a tough question. And eventually, the more rigorous evidence did come through, although maybe less dramatically.
Right. Like that narrative review of randomized clinical trials, the gold standard, it basically concluded that, yeah, fixing a diagnosed deficiency is important for general health.
Okay.
But just measuring the vitamin level, the 25-hydroxyvitamin D, doesn't reliably predict if taking extra supplements will actually change your outcome with COVID-19.
So fixing a known low level is one thing, but taking extra as a preventative or cure, the evidence isn't there.
Exactly. That's the nuance the headlines just missed. And this lines up with the official guidance, too. The WHO Mythbusters site is very clear. Vitamins can't cure COVID-19.
And the NIH in the U.S.?
The U.S. National Institutes of Health basically says the same. There's just not enough data right now to recommend vitamin D for preventing or treating COVID-19.
Okay. So wrapping this up for you listening, the big takeaway here seems to be that even when something is presented as scientific evidence, especially if it's widely publicized,
You need to be critical.
yeah, that critical scrutiny is vital. And these retractions, while maybe unsettling, they aren't science failing. They're actually part of how science is supposed to work, self-correcting, even if it takes time.
Right. It's messy, but necessary. And maybe a final thought for you to chew on. Knowing that so much public advice meant to feel helpful and warm, was based on research that turned out to be flawed. What other common health assumptions, maybe about supplements or daily habits, should you start questioning with that same critical eye?